want them prepared to be able to take the licensing exam. But the overarching goal, to get them to that place where they're confident when they transition into full-time practice, that they will be ready to go right there and then. The Master's of Science in Nursing is a master's degree in nursing, and then the FNP is the focus of the program. A family nurse practitioner is a nurse practitioner who can care for a family, babies to older people, across that lifespan. What we offer here at Dordt is our perspective. We are absolutely committed to developing students who are Christ-centered, who want to be part of that kingdom building. Even in the aspects of disease and illness, someone can fulfill their calling. And the nurse practitioner is so uniquely equipped to diagnose and treat that patient as any other provider would. But a nurse practitioner has her nursing roots that she falls back on, and very much what nursing is about promoting health and providing health education. For nurses, the online aspect is a good thing because most registered nurses who are becoming advanced practice nurses are also working registered nurses, and so doing the courses online allows them that flexibility. We have some basic criteria for the nurse to be able to be a part of our program. They need to have their bachelor's degree in nursing and 1,000 hours of what we call bedside hours. It's really important for graduate nurses to get that bedside experience of prioritizing and problem solving and just interacting and having a relationship with patients. So the first 2 years are the content, the didactic, learning what it takes to be a nurse practitioner. So this includes the pharmacology, health assessment, the pathophysiology, a couple of semesters of each of those, because that's the workload of the nurse practitioner. We have also added to our program 3 courses that are for advanced practice, the profession of being an advanced practice nurse. And so learning the scholarship, what is research and what is our role in research. We've also added 2 education courses, how to write curriculum, how to plan education, and then the clinical experiences is the 3rd group where they will gain that bedside experience, the assessment and diagnosis and treatment of patients who are ill. Clinical experience, all total is 750 hours, spread across 4 semesters, where each semester is 190 hours, focused on adults, on elderly patients, on women's health, and on children. And we want to make sure that the student has a quality clinical experience, and so helping that student make those decisions as far as where they go and who they interact with and what kind of patients they see. So we'll work with the student, but it will all be at the places that the students choose. In their community is the best because they know their community, they know their community population. I want them competent in their knowledge and their skills, but in their purpose, in their vocation as a called nurse practitioner to serve as kingdom citizens.